Hello, and welcome to this webinar entitled How to Prepare a Successful Video Abstract for the AUA Annual Meeting. Next slide, please. My name is Ariel Schulman, and I'm the current chair of the Urologic Video Education Committee. Our group is responsible for curating the video educational materials shown at the annual meeting and several other platforms, including the core curriculum videos and the surgical video library, which are available on the AUA University app. The goals of this webinar are number one, to explain the annual meeting video submission process, and number two, to share tips on creating educational videos that have a good chance of getting accepted for presentation at the annual meeting. Next slide, please. I am joined today by an all-star panel who comprise the last decade of leadership of the Video Committee to share with you their expertise. Dr. Jay Rahman is a urologic oncologist, a pioneer in robotic surgery, and current chair of urology at Penn State. He recently completed a 4-year term as chair of the AUA Office of Education, which was preceded by a term as chair of the Urologic Video Education Committee. Dr. Justin Hahn is a reconstructive urologist and currently serves as the residency program director for the Hofstra Northwell Urology Residency Program. He is the past chair of the Urologic Video Education Committee. I'm also joined by two critical members of our team from the American Urologic Association. Melissa Goodman is director of the annual meeting programs, and Katie Phipps is completing her 3rd year as the annual meeting program coordinator. They're both absolutely critical to achieving the goals of the AUA as well as the annual meeting. Next slide, please. So I'm going to briefly review the submission process for the videos. There are 11 submission categories that have remained constant over the last decade. For example, prostate, endourology, pediatrics. And you can see that the total number of video submissions has been increasing in recent years. In 2023, it was 541. 2024, 606, and most recently in 2025, an all-time high of 753 videos submitted. All videos get reviewed independently. There's a peer review and a scoring process that is made up of members of the larger urologic community. All videos are typically reviewed by 4 reviewers. After the initial review process, the videos are then reviewed by the Urologic Video Education Committee chair as well as committee members, and there's a final editorial review performed as well as session building. Ultimately, the final sessions are built. There's 12 videos per session, and there are the typical, the full 11 submission categories, and depending on the number of submissions, there may be additional sessions. For example, 2 sessions of prostate based on the number of submissions. Next slide, please. Here you can see the video sessions for AUA 2025. There were 15 total video sessions, as well as a 16th session that comprised the best video abstracts. You can see in 2025, there was each of the 11 submission categories, and the categories for prostate oncology, adrenal and renal oncology, lower tract reconstruction, and upper tract reconstruction all had 2 sessions because those had the largest number of video submissions. And finally, on the last day of the meeting, there was a best video session with the highest scoring videos in each category. Next slide, please. So now I'm going to turn over to Dr. Rahman for a discussion on tips for preparing a surgical video for the meeting.
Great. Well, thank you so much. So as mentioned, I'll talk a little bit about sort of the concept in preparing a surgical video. We'll start with maybe the first being, how do you select a topic? How do you actually choose what to make a video on? And I think there are a few elements of that. I think the first is what is your individual or your expertise within your institution? What are you doing a lot of where you may have a good vault or good reservoir of cases to select content to make a video? You want it to be timely. You want it to be something perhaps that is in your practice, but not so far into your practice that it's already part of regular practice and part of what most people are already doing. So you'd like to show something that is new, maybe novel, but also translatable. The idea here is not necessarily show the latest and greatest, the one-time surgery that's been done, but rather something that you're hoping other groups and other persons may be able to emulate, may be able to learn from your technique. And certainly, I think going to the AUA Video Library can really give you a sense of maybe what has been done in that domain, in that space over the last few years, and give you a little bit of a clue of where maybe the opportunity is and maybe where the niche is. The second part of it is I think the nitty-gritty, which is how do you put the video together? How do you time it? And what are the components of a video? And I think when you think about this idea of storyboarding, I think the first part is an introduction, which is usually about a minute or two. And I think you're really trying to introduce the concept, introduce the why. Why have you made this video? What's the need? What are you trying to show? And then really the meat of the video, and what I think most people are trying to really see and what they're looking for are the surgical clips. The different steps of the procedure, the different elements of the procedure, maybe portions that may be challenging, portions that may be routine. How do you get maybe from the start to the finish? And that should really be the majority of what your video is overall. Should be about 3 or 4 minutes. And then you want to close with a summary, about a minute or so. And I always think about the summary being the take-home message. Maybe if you've shown one video out of a series of 20 or 25, you can share your collective data, allowing maybe the viewer to understand the learning curve, maybe areas which could have taken longer, could have taken shorter. And so you want a summative at the end. And the last part are kind of the pitfalls, what I would consider the quality review checklist. You think you've made a great video, and here are the things that maybe just from a technical point of view can run you into trouble or could make this a video that isn't reviewed. And you want to make sure you keep an eye on this. The first is a maximum of 8 minutes. You want to keep it within the constraints. Obviously, we want to show videos of high quality. So you're really looking at something that's at least 1280 by 720 pixels and even up to 1080 pixels as well, which may be even better. The opening frame that you show should have a title, an author or authors in the institution, and it's critical not to have any patient identifying information because that will immediately render your video to be eliminated from consideration. Now, a few key things are you don't want to have an 8-minute video playing that's completely silent. You'd like there to be some type of audio, some type of music, or maybe sometimes even both. But if you are going to use music, you have to make sure that it's not copyrighted music because that's again something that would render your video ineligible for presentation. And obviously, as we do a lot of these techniques and these surgeries, we are using instrumentation and devices made by our industry colleagues. And you really need to make sure that if you are showing some of this, that you disclose commercial funding. And I would say more than anything else, just look for your own integrity when you make these videos so that they don't appear to be a reflection of commercial bias, but rather something that's balanced where you're trying to show a device, a technique, or a procedure, accepting that commercial or industry partners have contributed, but certainly not being an advertisement for that.
So that's an excellent summary of the elements of making a surgical video. I do want to emphasize one point that you brought up, and because this is the AUA, this is the highest standard and competition of surgical videos. So the if you have what very frequently happens is you have a single very high quality video of a specific technique, but your institution may have a larger experience, as you mentioned, or there may be a larger experience published in the literature. And I think it's important to add that information somewhere in your video, maybe towards the last minute, to show the viewers that this is a very high quality video and it's not just an isolated case report, it's a reflection of our, as you said, our institution or a national experience. So now we're going to move on to Dr. Han, and he's going to discuss a little bit about the reviewer perspective and going from the basics of a video to a high scoring video that's going to get accepted to the meeting.
Thank you, Ari. As you can see from this slide, there are some key and standard elements of high scoring videos, and we're just going to run through these briefly. First, as a reviewer, we are given a score sheet where we have to look at these 4 initial subcategories for the scoring, and they're graded from a score of 1 to 4 in the categories of originality, presentation, interpretation, and the overall impression of the video. And so each reviewer is looking at the video and throughout the process thinking about these 4 areas. How original or novel is the actual technique or content, how the video is being presented, that includes the quality of the images in the video, and then how the interpretation of the conclusions in terms of what was being presented. And that kind of goes to that last summary slide that Ari and Jay were mentioning. And then finally, the overall impression of the video. From a technical standpoint of the presentation, you want clear narration. You want to have good annotation of the video. So at certain point in times, perhaps have a still image that is emphasizing a certain anatomy or a certain image that you would like to show, and perhaps annotate that in the video, either written or verbally. Those can really help the reviewer see what you're trying to do and help the viewer understand your video. In terms of originality, again, we talked about having a novel technique, something that's cutting edge, but also potentially transferable. Sometimes doing something that's so esoteric may be too far out there. So it's sometimes a little bit of a fine line, but certainly something that is original and interesting that perhaps others can learn from. And then in terms of the interpretation, as we mentioned previously, we're talking about sort of the take-home message, the summary of this video, why it's interesting, why it's important. And if you have a broad institutional background and experience, presenting that as well, and that will give the reviewer some additional perspective. You can look at some of previous Best Video awarded videos as examples to go by, and really remember to try and keep things smooth and easy to follow. Try not to have too distracting of the music or the background. Sometimes that could take away as well from videos.
Excellent. So as Justin mentioned, what I think is critical to get a feel for the type of videos that are at the meeting, especially if you are a resident, earlier career resident, or even a medical student, maybe you've never been to the AUA before, but the best thing to do is take a look at previous videos and the best video winners. So we have up here on the screen the last year's best video winners for each category. As you can see, there's a list of each category on the left and the award-winning video on the right. Now, there are 2 ways to track these videos down. The first way is in the AUA University app, there's a surgical video library, and we'll talk a little bit about this later. But as every AUA member has access to this, and it's a complete searchable library of all the surgical videos from the AUA for the last 15 years. You can type in the title of the video, as you see here, the title of any of these videos, and that's going to bring up that specific video for the meeting. But you have here on this screen last year's best video winners. The second way to find best videos is on the AUA University YouTube page. There is a tab for best videos, and they have best videos from every meeting going back to 2017. So that's really the best place to start for thinking about your videos. Next slide, please. And you can see here, this is the list of the best video winners for 2024. Again, if you are in the planning stages of, for example, A Stone video, I would recommend certainly looking back at the last 4 or 5 years of the award-winning Stone videos, and also go into the Stone video sessions. You can get the records of full sessions in the Journal of Urology supplement that usually comes out at the same time as the meeting. So I would go back and watch maybe the full breadth of the Stone video meetings, and that's going to give you a pretty good idea of the type of work that's being accepted and presented. Next slide, please. So a very common question is, what happens to videos after the meeting? So there's typically between 150 and 200 videos that are presented at the meeting each year, and there are several places where you can find them. Number one, the AUA University digital app. This is, as I said, available to all AUA members. Within the AUA University app, there's a surgical video library. It's greater than 2,000 videos, every video that's been presented at the meeting since 2011, and it's searchable. So, for example, if I was thinking about doing a video on a buccal ureteroplasty, I can search buccal ureteroplasty and find videos, or if I know certain very high volume surgeons that have produced a lot of videos, I can search by name as well. And by doing that, I'm going to get a good sense of the most recent videos that were produced, and that's going to put me on my way to making my own videos. As I also mentioned, the AUA University YouTube page, if you search, there's a couple of tabs through the YouTube page, and one of the tabs is the best surgical videos. That is updated as of 2024. So you have all of the best award-winning videos from 2004 going back to 2017. You can watch a full reel of those videos. And as I mentioned, the comprehensive list of videos is also published in the Journal of Urology supplement each May, accompanying the meeting. A final area that has been a nice feature recently, there's been a push to take some of the videos from the meeting and publish them in a more of a case report, a PubMed citation form in the JU Open Plus. John Davis is the editor-in-chief. He's also a member of the Urologic Video Education Committee, and he has taken great efforts recently to find some of the best videos and get those published in JU Open Plus, so you could take a look in there to see some more of them as well. And next slide, please. And finally, Melissa and Katie are going to discuss some of the common questions about the video submission process.
Thank you.
Thank you. So our frequently asked questions, Katie, where can I find more technical information regarding video submissions?
So on our annual meeting website, AUA 2026, under abstracts, you'll see abstract guidelines. There's guidelines specific for the written portion of the abstract and then the video submission portion. And I've also condensed and highlighted a guidelines for what we talked about earlier, the quality review process and what will be automatically rejected based on copyright infringement and that sort of thing.
What is the submission deadline for AUA 2026?
All abstracts must be submitted by November 3rd, 11:59 p.m. Eastern Time. We will not accept abstracts submitted late. So make sure that you submit early so your video can go through quality review in time for the actual deadline.
Great. Where can we covered this.
Yeah.
But where can I find videos from previous meetings?
Surgical Video Library, which is available in the AUA University app and on the AUA University YouTube channel.
Yes, wonderful resources. Do I submit a paper abstract with my video submission?
Yes, you do. So it's not just a video, a written abstract is also required, and those guidelines are available on our website.
Can I submit a video abstract that was already presented at another conference?
No, typically no, unless it was presented at a small sub-society of the AUA, and it was not previously published or presented in a large format. So if you have any questions about previous presentations or publication, please reach out to us. Our contact information is available on our website. Thanks.
Thanks.
All right, this is that's excellent information. So I just want to open up for any questions from the group. We've had over a decade of leadership of the Urologic Video Education Committee, and any thoughts from the group or any questions, things worth noting?
I think one question that people have previously raised are how are the best videos selected? And from my understanding, they've been selected based on the lowest score, aggregate score, and they've already been pre-selected prior to the meeting. Is that correct, Dr. Schulman?
Yeah, so the peer review process, we have 11 categories, and we make review teams. For the larger categories, they may have up to 3 review teams, and there will be and all the videos get scored. So we have the scoring system, but the highest scoring videos will so the highest scoring video in the section by the peer review process will typically win the award for the best video of that category.
I think the one comment I would make is, you know, if you look at the different abstract categories for the annual meeting, the video submissions are amongst the fastest growing, and you showed some very nice data on that. And I think as more submissions come in, obviously the quality of the submissions I think needs to be higher. Those that are selected are really the cream of the crop, and I think that's intended because these are really broadcasted as sort of the signature videos that are housed within the home of the AUA library. And so I really hope, I think this is great that you've really taken some time to put this together, because I think it really helps as a playbook, because everyone wants to make the best video they can. And I know all of us that have made videos that didn't get in always ask, I wonder why my video didn't get in. So I think this is great to put this together to really hopefully equip people with the best skills so that we get the highest quality submissions.
Yeah, and you know, I think we all work with trainees, and many of the videos do come from the trainees because they have the energy and the enthusiasm and the time to make the videos of the surgeries that the attending physicians are doing. But I really emphasize to my trainees that video production is a skill that takes time to master. It's very unlikely that you are going to sit down and make a video and that's going to be accepted to the AUA meeting. It's very unlikely. What's much more likely is you start the process. You start to make a video. You start to understand the technical pieces of it, and maybe that video will be accepted to a subspecialty meeting, and you'll go to a smaller video session, and then you'll start to see more videos. You'll learn about more techniques. You'll learn how to be more concise and how to pick a better topic, and maybe how to collaborate with better collaborators who are doing other interesting work. Other videos that are really making their way into the meeting are technique-based videos. For example, using AI to improve your patient interaction. So I think if you look at videos over the last few years, I would say it's expanding in that way from just a surgical technical video to using new technology, patient counseling, and using different tools together, telesurgery, you know, intercontinental collaboration, and so forth. So these are really all the things that I tell trainees and people that are looking to get their videos into the meeting. Okay, so if there's no more comments or questions, I really want to thank the panelists. Each of you has been a major driving force in the success of the Urologic Video Education Committee, as well as the video sessions at the AUA. They're always very well attended, and I just want to thank each of you for all of your hard work, and then for taking the time this evening to share with our viewers. And I'm looking forward to reviewing all the excellent videos from this year, and then seeing everything come to life in Washington, D.C. in 2026.